My topic is abdominal hernias. So what is an abdominal hernia? It is a weakness in the abdominal muscle wall where a segment of the bowel or other structure protrudes. There are 5 common types. The first being indirect inguinal, and you can see that it's a sac form containing a portion of the intestine that goes down at an angle into the inguinal canal, and in males this can descend into the scrotum. Here we have our direct inguinal. It's also a segment that passes through the weak spot in the abdominal wall. We have our femoral, and this protrudes through the femoral ring. So normally this would just look like a lump over the skin. We have an umbilical, and this is through the congenital defect in the abdominal muscle. And next we have our incisional, and this is caused at the site of the previous surgical incision. It's a result of inadequate healing. So there's 2 types of management for abdominal hernias, and the first being non-surgical and the second being surgical management. There are 3 different classifications of hernias, the first being reducible, and this is where the contents of the sac can be gently pushed back into place with gentle pressure. Then we have irreducible, that cannot be placed back into the abdominal cavity, and this usually requires surgical attention. We also have our strangulated, and this is when the blood supply to the hernia is cut off by muscle around the hernia. And the signs are abdominal distension, tachycardia, nausea, vomiting, pain, and fever. And this is a medical emergency, so as soon as the nurse suspects this, she needs to report it to the physician. And lastly, some risk factors include the male gender, advanced age, increased intra-abdominal pressure, usually related to pregnancy or obesity, and genetics. Thank you.